This is Dr. Russell Blaylock, and you're listening to the Blaylock Health Channel. Today we're going to talk about atherosclerosis, that is hardening of the arteries. What exactly is hardening of the arteries? Well, it's a slow buildup of this material in the artery that eventually produces this crud we call plaque that obstructs the flow of the blood through the vessel, not completely in most cases. But the danger is that it'll induce a thrombosis, which is a blood clot, and this blood clot in turn will block the flow of blood. If it does it in the heart, it produces a heart attack. If it does it in the arteries to the brain, it produces a stroke. So this is the process. Now, it begins quite early in life. What we find is even in babies, we see some of the early changes of atherosclerosis. And certainly by the time a child is 10 to 15 years of age, we begin to see what we call fatty streaks. These are the earliest changes. These are little streaks of yellow fat that embedded in the wall of that vessel. Studies that were done during the Korean War on young veterans who were killed during the war found rather extensive atherosclerosis in their vessels. So we see a lot of this process begins quite early. Toward middle age, these fatty streaks begin to mature into more fibrous type plaques and these raised areas that push out into the center of the vessel, and the blood has to flow over it. It's quite rough at times. That can activate clotting and cause microemboli or clots to be thrown. Now, when you develop these plaque-like things, what is happening is that the fats that have entered the vessel become oxidized. And when they become oxidized, they become inflammatory, and they produce an inflammatory response inside the wall of the blood vessel. Your body recognizes that as a danger, and so it sends white blood cells from your blood into the wall of the vessel to try to contain this. And it produces a sort of a shell around it, like you see in an abscess, where there's a thick wall of fibrous tissue around it, trying to wall it off and cool down that inflammation. If it's successful, then the plaque will not get any larger, and you're not really in danger from that plaque at all. That's called a stable plaque. But sometimes what happens is it cannot form this thick shelf of fibrous tissue over the surface of that abscess-like collection of inflammatory fat, and it'll break loose, and it breaks into the wall of the blood vessel and can trigger a thrombosis, that is a blood clot to form. If that forms in the heart arteries, it produces a heart attack. If it does it to the arteries to the brain, it produces a stroke. We call that an unstable plaque. That's the most dangerous plaques. This cholesterol theory that had started sometimes in the 1930s through 1950s actually was a misinterpretation of the early research. And I went back and looked at this research, and what I found was that they could not dissolve the cholesterol except in corn oil. So all the experiments were done with the cholesterol dissolved in corn oil and then fed to the animals. Some of the experiments found that if you took the cholesterol itself and actually injected it in the artery, you couldn't produce atherosclerosis. Only if you mixed it with the corn oil and fed it orally could you produce this atherosclerosis. They assumed from then on that it was the cholesterol, and they never suspected it was the corn oil itself that was doing this. Corn oil is a polyunsaturated oil. It's oxidized very easily. When it oxidizes, it becomes quite inflammatory and irritating to the wall of the vessel, can enter the wall of the vessel, and produce atherosclerosis. New studies are showing that if you feed corn oil alone to animals, you'll produce extensive atherosclerosis, and that often this oil is oxidized when you're eating it. In other words, you put the oil on your salad. Peanut oil, safflower oil, sunflower oil, soybean oil, corn oil. If you put this oil on the salad exposed to the air, it oxidizes, and so it's already oxidized when you eat it. But it can also oxidize inside of the bloodstream itself. So now the new research is saying, well, it doesn't seem to be the cholesterol itself, because unoxidized cholesterol cannot produce atherosclerosis, only if it's oxidized. And that the polyunsaturated fat seem to be the major fat that's producing the problem. Now, when you look back in the literature at the pathology of atherosclerosis, a pathologist by the name of Virchow back in the 1800s described atherosclerosis of vessels as looking like an abscess. And if you've ever looked at it in a pathology lab, it indeed looks like an abscess. And if you look at descriptions of it, when they section it, in the center of this atherosclerotic plaque is what looks like an abscess. It's full of this pus material, these white blood cells we call foam cells. They're macrophages filled with this inflammatory fat. So there was a lot of evidence that this, in fact, was an inflammatory problem. Well, almost all the compelling research we have now says that atherosclerosis is an inflammatory disorder. It's not a disorder of eating too much cholesterol or having too high cholesterol in your blood. Many animals have very, very high levels of cholesterol and very low evidence of atherosclerosis. And then we have things like the Israeli paradox, in which the people of Israel have much lower cholesterol levels than other people in other nations, yet they have one of the highest heart attack and stroke rates of the nations. When we look at some of the efforts to try to salvage this cholesterol theory, they said, well, maybe it was the fact that it's only LDL cholesterol that causes the problem. Well, there's two forms of LDL. There's a small molecule and a larger molecule. It's now been found that the larger molecule actually is protective against atherosclerosis. Only the small molecule can cause any problem, and that's because the small molecule is easily oxidized, and it can be oxidized by the already inflamed and oxidized polyunsaturated fats. To many people's surprise, HDL, which we're always told is the protective form of cholesterol carrier, that is not always so, that HDL is used as an inflammatory molecule when we have an infection. For instance, if you was to develop a viral infection, your HDL switches to this inflammatory molecule, and it can produce atherosclerosis just as quickly as the LDL molecule. So our whole thinking about cholesterol and the lipid components has changed rather drastically. And now we see that things that increase inflammation are the most likely to cause atherosclerosis and lead to heart attacks and strokes. High on that list is consumption of sugars and consumption of simple carbohydrates like white flour and things low on the glycemic index. We also notice that black people have a much lower cholesterol, yet they have the highest rate of heart attacks and strokes than other races that have higher, sometimes much higher, cholesterol. So there's a lot of evidence accumulating that, in fact, there's no strong linear correlation between your cholesterol level and your risk of heart attack and stroke. But there is with inflammation. If we measure inflammation in people, those with the highest inflammatory processes going on in their body, despite having low cholesterol, will have a higher risk of a heart attack and a stroke. This is driven home by looking at diabetics. Diabetics, even those who have very low cholesterol levels, are at a high risk of a stroke and a heart attack because they have high levels of inflammation, very low levels of magnesium. When magnesium is low, your body becomes inflammatory, especially inside the blood vessels. Now, why do statin drugs work at all? They don't work very well. Even with drastic lowering of cholesterol, there's been no significant reduction in heart attack deaths or the heart attack incidence in the United States or other places that they've been used now for almost 20 years. We should have seen a drastic difference, but we didn't. The only reason that the statins work is because they're immune suppressants and they have anti-inflammatory capability. But the problem with them is there's so many serious side effects, even some of which can be quite fatal. Some can cause a loss of memory, degeneration of the brain. The brain needs a rather high level of cholesterol. What we do find is that natural substances like curcumin, quercetin, aged garlic extract, resveratrol are very potent inhibitors of inflammation in these blood vessels. And the studies that's been done in atherosclerosis models, animal models, has shown that it's very powerful, not only inhibiting the formation of atherosclerosis, but can even reverse atherosclerosis in some degree. So what should you do? Well, you need a higher intake of things like curcumin and quercetin, which are fat soluble. You mix them with extra virgin olive oil. You take aged garlic extract, which you can get as a capsule. You avoid all the omega-6 oil. That's corn oil, safflower oil, sunflower oil, peanut oil, and soybean oil. Canola oil has a fair amount of omega-6 oils too. It's a polyunsaturated oil and should not be used on salads or in cooking. These will rapidly oxidize and produce atherosclerosis. You should increase your vegetable intake, at least 5 to 6 servings of vegetables. Even higher would be better, up to 10 servings. If you blenderize these vegetables, you get a very high flavonoid content in your blood, and that's what counteracts this atherosclerosis. You should avoid milk, particularly cow's milk. Don't eat excessive amount of cheese. Do not use margarine. It's a polyunsaturated fat in margarine. Use butter instead. Avoid fluoride. Fluoride combines with aluminum and produces a very damaging effect to blood vessels, particularly the small blood vessels in the heart and brain. Avoid exposure to heavy metals such as lead, cadmium, mercury, and aluminum. And eat fewer red meats. Red meats contain very high levels of iron. You absorb the iron very easily, and there's a very strong correlation between elevated iron levels in the tissues, and particularly the blood, and atherosclerosis. People with a lower iron level have far less atherosclerosis. And this is why if you eat good servings of vegetables with the red meat, it significantly reduces this atherosclerotic effect. Red meats are also very high in glutamate, and glutamic acid has been shown to produce prolonged inflammation and free radical generation in the walls of these blood vessels. So I hope this brief little lecture has given you some new insight into the newer findings in atherosclerosis and what you can do about it. Thank you. The information contained within these programs is not intended to replace or contradict that of your physician. This information is for educational purposes only.